your dog has allergies or is chewing, scratching, or licking excessively, this message is for you because it's very possible that the problem is actually not allergies, but muscle, nerve, joint, or back injury that has been left undetected. I estimate that more than 3/4 of all dogs are misdiagnosed with allergies and put on toxic side effect causing medication that suppresses the immune system and causes more problems. Don't miss this opportunity to learn more about what to do about your dog scratching, itching, and licking. All you need to do is to go to petertobias.com/allergies. Join our community and get all important articles, resources, and other materials that have helped many dog lovers to solve their dogs' allergies and live a happy, long, itch-free life. Again, the web address is petertobias.com, petertobias.com/allergies. Hello, my dog lovers and other folks. This is Dr. Peter Tobias, and you're listening to Not Just About Dogs. Today's episode is very special, and not necessarily only because of the content, but also because of the fact that this is the 4th time I'm recording it. Every time I save the file, and we save it on Dropbox for my editor, lovely guy Liam, helping me to edit this episode, we end up with some sort of really serious noise and interference. So this is the 4th recording, and I hope that it will be okay. We figured it out. And it's also a reminder that when something hits a fan, why don't I just say that? When it hits the fan, you just can't really easily give up. Because if you give up, then the dark forces win. Anyway, today we're going to be talking about energy lines, spine, watering system, and all sorts of different cool things. So no matter whether you're a dog lover and you have a dog in your life or not, this is really important, and it will make a difference in your life and in your health and in your understanding of your well-being. In the past few podcasts, I talked about essential building blocks, how important they are for your dog's health, whether it's minerals or vitamins. But there's another component to the body and to health that I didn't talk about before as much. But before we go into energy flow in the body, I'd like to start with a house and house construction, because it is very similar to how the body is constructed as well. When you build a house, at least in North America, we build the frame. We build the wooden frame that is relatively fast to build. However, when you start putting the plumbing and electricity and do all the finishing, it's much more difficult. And with the body, it's a little similar. When I took my anatomy courses, bone anatomy was pretty trivial, pretty simple. You have all these bones in the body, you learn them, you learn the little bits and pieces and parts of the bone where the nerves and muscles attach, and you are ready to go. But when it comes to blood vessels, nerves, and brain, it's a totally different story. And I compared the bones in the body to the framing in the house, and the blood vessels and nerves and brain is the wiring. It's the electricity, it's the plumbing, it's the Wi-Fi, it's the internet. All that stuff has a completely different level of complexity. Now, I have always been really intrigued by the fact that while it's kind of complicated to build a house, nature builds the body without anyone supervising it, anyone telling anyone else what to do. I am amazed that the blood vessels know where to grow. I'm blown away by the fact that the nerves know how to connect and what parts of the brain should they connect to or come from, and what muscles and organs and cells they should actually control and command. it is kind of a miracle. And when it comes to blood vessels and nerves, that's one thing, we can see them, but there's another invisible force that I call the energy lines. In Chinese medicine, it's called the meridians. And they're the energy lines that basically allow energy flow from one part of the body to another. So you end up having a little point on your hand controlling your immune system, or a little acupuncture point on your ear controlling your kidneys or your liver. If some of you wonder why I use the word energy, well, the whole body is energy. If you think of how the body is built, it's actually put together from electrons, protons, bosons, and other energy particles that are invisible. And whether you're a human or you have a dog or you see a butterfly, all these life forms are made from the same building blocks, from the same particles, and they're nothing else but energy. So the difference between the butterfly, the dog, and a human is in how the articles are put together, how they're programmed. And that's the mind-blowing thing. And if the body is just energy, it makes complete sense that there are energy lines and energy meridians. The Chinese have known that for thousands of years, and some holistic approaches to healing and health know it too. There is another really cool aspect of life and different life forms, and that is that the body is usually segmented. When you look at a bee or wasp, you can see the segmentation very clearly. When you look at a salmon fillet, you will see the same thing. You will see the segmentation of the body, and it corresponds with the spine and the spinal segment, the vertebrae. When you look at a dog anatomy or human anatomy, the segmentation is not as clear because we are much more complicated, and the muscles kind of are intertwined, and they have evolved differently than, let's say, simple muscle structure of a fish or a skeleton of a bee. But one thing you can learn from this structure, that certain segments of the body, skin, organs, muscles, relate to a particular vertebra. And that's super important. Now, let's get away from the body for a moment and imagine a garden. Most gardens now have watering systems where the main water pipe goes in the center of the garden and then it branches out to the garden beds. In the body, the spine is the main pipe in a way, and it supplies nerves to the organs and cell and the skin on the periphery of the body or away from the spine. When the garden system or the watering system is broken, or the main pipe gets affected by some sort of constriction or pressure or hole, obviously the whole watering system will start failing. And if one of the branches is affected or pinched or twisted, the garden beds that are affected will have produce that will not grow as well, will not thrive, or maybe it will not grow at all. Now, in the body, the same things happen. The spine guides the nerves, the blood vessels, and also the energy lines to the periphery, to the skin, organs, and cell and muscles. If any of these pipes, in quotes, the blood vessels, nerves, and the energy lines are constricted by the spine being affected or by the muscles along the spine being misaligned, that can lead to similar things. Suddenly we start seeing organ failures, skin problems, itching, muscle pain, inflammation, and tightness. And this is what I'd like to talk about because it's super important in order to keep your dog healthy and also keep yourself healthy. I call this whole premise the pinch hose principle because it is very much like that. If the energy lines are restricted, if the blood flow is restricted, nerve flow is restricted, the same thing happens that happens to garden if the watering system doesn't work. I safely guess that you're probably wondering, how do you recognize this problem? How do you recognize that the energy flow in the spine or the blood flow and nerve flow is congested or stopped? How do you recognize an injury? For gardener, a leaky hose or kinked hose is easy to recognize, but it is not as easy to recognize a spinal misalignment or instability or some sort of problem. The big issue here is that we veterinarians have not been trained to recognize these misalignments and subtle abnormalities. We have been taught to take x-rays and see if there is a severe injury of the spine or narrowing of the intervertebral space. But when it comes to subtle, invisible changes, we have not been trained to recognize them. For more than 2 decades now, I have been working with amazing people, chiropractors, physical therapists, massage therapists, acupuncturists, who have taught me to recognize and understand how important the spinal alignment is. It's as important as the main watering pipe in the garden. I give you some suggestions about how to recognize injuries. I'd like to talk about how they happen. Dogs love to be active. They like to play, tussle, chase the balls, chase the frisbees. Some people like taking their dogs biking. And unfortunately, many of these activities are not what dogs would do in nature. Dogs would not chase 20 or 30 bunnies in half an hour the same way they do when they chase a ball in the park. Most dogs would not be running fast behind a bike in nature. Canines in nature would roam, maybe sprint for a very short time when they hunt, but most of the time they would roam and play and would not engage in very severe, intense activities for extended period of time. This leads to many injuries. Slipping and sliding can lead to misalignment of the spine. Excessive running and sprinting may lead to muscle tightness. And all those, whether it's an injury or an accident or some sort of excessive strenuous activity, all those will lead to either misalignment or excessive tone and tightness and inflammation of the spinal muscles. And because the branches from the spine go through the muscle mass, when these muscles get tight, those branches of blood vessels and nerves and also energy lines get restricted, constricted, and congested. And sometimes the flow stops completely. In practice, it would be very difficult for me to find a dog that would not have any of those kinks and twists and inflammatory spots. You can recognize it relatively easily when you train yourself. One of the symptoms is excessive muscle tightness or pain. Dogs that are tight or painful chew or scratch, and this is something that most people do not know and many veterinarians do not know. Every time a dog scratches or itches, people think that there is skin problem or some sort of itching or fleas. But it can be muscle tightness and pain why dogs itch. Dogs that are injured or have energy congestion issues have also discomfort along the spine. I will tell you later how to recognize these spots along the spine. The areas may be also warmer to touch. And the most important part is that the skin, muscles, and organs adjacent to that particular congested or injured segment will not be thriving. You may start seeing skin rashes. You may start seeing muscle spasm and tightness. We all know that when our neck gets tight, our shoulders get tight, and sometimes we may even have tingling or pin and needle sensation in our hands. And that's how our dogs feel as well. Organs adjacent to the particular spinal segments and organs do relate to a certain segment, they will start being weaker and sometimes they even fail as a result of these spinal misalignments and injuries. So what do we do about all this? Well, I'd like to actually give you some examples of how this can be used in medicine and treatment. And maybe it'll give you hope that your dog, no matter what the condition is, can be better than they are. I would like to give you 4 different examples where I applied this principle of energy and spinal congestion. The first one is urinary bladder incontinence. The second one is diarrhea. The third one is stomach bloat. And the last one is paw licking. Incontinence is an interesting one. I discovered this connection when I treated a dog of my friend. Her name was Kaz, and she was a lovely rescue dog that my friend rescued. Unfortunately, she was incontinent. I treated her maybe for about a year and a half, and unfortunately, the regular approaches and the conventional treatments didn't work. And I was really puzzled and frustrated. And one day I asked my friend if I could take Kaz for a walk with her. So we went for a walk, and my friend took a ball chucker and she started chucking the ball for Kaz. And we got to the car after about half an hour, 45 minutes, and Kaz peed in the car. So I thought, wow, this is kind of interesting. It looks like it's related to the exercise. And it made a lot of sense because, the exercise engages certain type of nervous system, which is called the sympathetic nervous system. And when the exercise finishes, then the parasympathetic nervous system kicks in, which actually controls the actual bladder walls. However, the bladder sphincter is actually sympathetic nervous system. So you have this kind of swap after the exercise finishes. You have this swap from sympathetic to parasympathetic, and the bladder walls contract, the sphincter will relax as a result of the relaxation and the sympathetic nervous system being a little lower, and a dog leaks. But that is not the end of the story. When a dog runs, the spinal muscles, the lumbar muscles get tighter. And if a dog runs on an ongoing basis, on a repeated basis, and is kind of injured or inflamed in that area, the nerves that go to the bladder sphincter actually originate from the lumbar spine. And the muscles that are tight pinch those nerves, and the sphincter basically numbs out partially. And that's how incontinence happens. I know that some people may object that this condition is related to estrogen deficiency and SPAY, and I'm not necessarily saying that it's not. But if we treat those, the estrogen deficiency, only about 50 to 60% dogs actually respond. I suggested my friend that she stops exercising vigorously and takes her dog on hikes and maybe walks and take it a little easy. And after about a month, things were better. And after several months, things were even better. And we engaged chiropractor, and I also gave some homeopathic remedies. And after almost 2 years, I solved this puzzle. I was really thrilled, but I also knew that many dogs are still put on estrogen medication that causes cancer. Many dogs are put on medication that makes the bladder wall more flaccid and less strong. But to me, that's not medicine, especially if I give drugs that cause side effects. So I was super happy that we solved this problem, but there were many other conditions and health problems that were to solve. And one of them was diarrhea. The teacher about how to deal with diarrhea was my dog, my first dog, Sky. When he was about 6 months, he started having bouts of diarrhea. And it was around the same time when I treated Kaz. And I didn't know that ball throwing could actually damage my dog to that degree and could cause diarrhea. But after about 2-3 months of really battling with bouts of diarrhea, not knowing what to do because I fed proper food, natural food, and gave all the supplements and everything that he needed, he still wasn't well. So after Kaz actually recovered, I started to think maybe there's something similar going on with Sky, because I was throwing the ball and I stopped. And guess what? The diarrhea stopped. So, since then, I have developed a really detailed treatment plan and program that you can find on petertobias.com. And it's about diarrhea and how to treat chronic diarrheas. Many of these dogs are diagnosed with diet allergies, and they're put on elimination diet and hydrolyzed protein food and all those things that I do not necessarily believe are healthy for our dogs. And at the end, it's back misalignment and muscle tightness. It's kind of crazy. And this is why I love this approach to healing. This is why I am determined to tell everyone who's willing to listen that some of these conditions can be actually treated without drugs and chemicals. Stomach bloat is another condition that is commonly related to spinal energy flow. The stomach gets its supply from the space in between the last thoracic and the first lumbar vertebra. I've noticed that dogs that have congestion in that particular area would actually be more likely affected by stomach bloat. One time I talked to an emergency veterinarian and asked him whether he's seen some sort of changes in the spine or along the spine in dogs that do get bloated. And it's a serious, very serious, life-threatening condition. And he confirmed that quite often he sees actually arthritic or spondylotic, we call it, changes in that area between the last thoracic and first lumbar spine. And spondylosis and arthritis of these vertebrae happens when the muscles get tight and the body creates this bridging at the lower portion of the vertebra to prevent the disc protruding and prolapsing and getting injured. But it obviously is a sign that there has been a long-term problem in that particular area. And if the energy flow doesn't get to the stomach, then the stomach is weaker. It's more flaccid, it is not as muscular, and it is more likely to bloat. I really urge you to pay the attention to this area because it also supplies energy and blood flow and nerve flow to the pancreas. And we know pancreatitis is quite common in dogs as well. And obviously pancreas gets involved when there's diabetes because it stops producing insulin. So the thoracic lumbar junction is one of the prime areas of my focus and should be yours. The last condition that I'd like to talk about is paw licking. There are so many dogs who lick their paws excessively and they can damage the skin, cause skin infections, get put on antibiotics and steroids. And again, this condition is often diagnosed as allergies. Unfortunately, most of the time, it's not. What happens in these dogs is that they pull on the leash or they're put on the retractable leashes that are spring-loaded. And people also use the brakes in these leashes. And when they do, it actually creates this little jolt on their dog's neck. And then the nerves and the blood flow to the feet gets affected. What happens, dogs most likely feel some sort of pin and needle sensation the same way we do when we have neck pain or injury or some sort of trauma. And when they do, they start licking. And when they lick, they traumatize the skin, and bacteria and yeast harbors in those areas because they're already weakened. We know that the skin of a segment that is congested is weaker, doesn't thrive as well. The same way the garden beds in the garden do not thrive if the watering system is affected, broken, pinched, or somehow not right. If your dog is licking his or her paws, I highly suggest that he start using a harness. It took me about 5 years to find the right harness, actually more than that. I started looking in the late 90s, and pretty much in maybe around 2010 or 11, I came across a harness which is called Perfect Fit. It's made in the UK, and I use it for Pax. He's never had a leash attached to the collar, and he's 2 years old, believe it or not. And it is because I've seen so many injuries and so many problems, and I also suffered from a neck injury, so I know what it feels like. And I encourage you to explore Perfect Fit on our website at petertobias.com. So, what is left is how to examine your dog's spine. Because while your veterinarian may be doing their best, they're not trained to examine the spine. Chiropractors, physical therapists, and acupuncturists or massage therapists are. It's relatively easy. I use it in practice all the time because certain organs actually will send signals up to the spine, or if the spinal segment, as I said, is injured, these organs may suffer as well. So if I get a dog in my practice, the first thing that I do, I position him or her in between my knees, head facing away from me, and then take my two thumbs and press along the spine quite firmly, almost like if you wanted to press on an orange or melon. If the particular spinal area is fine, your dog will probably not react at all. But if there is congestion, sometimes you see skin twitching, muscle twitching, dogs may look back, and if they're really sensitive, they may really try to let you know that you shouldn't be touching them there. I run my hand along the whole spine and see which areas are sensitive. And if I find any inflammation or pain or discomfort, I immediately seek help of a chiropractor, physical therapist, acupuncturist, massage therapist, someone who understands how to actually relax the muscles and align the spine. There's another technique that I use and is really cool. You can run your hand about 1 inch above your dog's body and notice the difference between the different areas. The healthy segments of the spine, there's no heat. You will feel less heat. And I usually compare it to a little bit of a breeze under the hand. When there is nice flow, it's kind of breezy and cool. And when there is no flow or reduced flow, it's muggy and hot. If you have a young dog, it's actually a good idea to practice this when the spine is really healthy, because then you'll get a better idea what it feels like when it's not normal. So now when you know how to examine your dog's spine and how to look for these abnormalities and twists and kinks, it may be a little easier to keep your dog healthy, because the spine is the main energy, blood, and nerve guide to the different organs and segments of the body. The good news is that the same applies to our body. So if you have any back pain or congestion or chronic neck pain, do not neglect it, because I've seen serious problems arising from misaligned spine, from inflammation along the spine. There is one more little note I'd like to make. Sometimes when the organs are affected, let's say the liver is toxic or the kidneys are stressed from dehydrated processed food, they may signal up to the spine, and the muscles along the spine will get actually tight. So if you find the congested spots, it may be either that they originate from the spine, from excessive exercise or some sort of injury, but it may also mean that the organs are weak. So it's hard to know sometimes what came first, whether it's the chicken or the egg, but in either case, it will give you a better idea how to keep your dog healthy. There were moments in my practice where I would examine a spine of a dog and there was a very severe reaction. One of the areas that I remember that about was the interscapular region, the region in between the shoulder blades. The area is responsible for supplying the heart and the lungs. And if I saw a dog that would have very severe reaction in that particular segment, I would send them immediately for chest x-rays, and quite often I would actually find a tumor or something very serious. There's another interesting part of this where the breeds that have very straight legs and very narrow interscapular region have also propensity to cardiac disease and dilated cardiomyopathy, which is basically weakness of the cardiac muscle in simple terms. I've seen this very commonly in boxers and Doberman pinschers. And when you look at them, yes, they're very straight-legged. They have been bred that way, and they have very narrow interscapular space. So again, once you start connecting the dots, it becomes really interesting. And I've never stopped being curious about how to apply these methods in different parts of healing and medicine. And I hope you will too. I hope that not only your dog will benefit from this podcast, but also you, and that you will share it with others. And if you have any questions, you can always connect with me through our website or through my website. I say ours because it's my team and I. And we will be very happy to answer your questions. You can also use the search window on my website at peterdobias.com. It's peterdobias.com. And you can find answers to many different problems and conditions. And usually they are naturally oriented and drug-free whenever possible. Thank you so much for listening, and give your dog a hug for me. Take care. Bye-bye.